Public health officials say there are now 4 confirmed cases of the Zika virus in Canada. This fast-moving virus has been linked to devastating developmental disease and defects in babies. All 4 Canadians became infected while traveling to areas most affected by the virus. The viral infection is transmitted by mosquitoes, but that breed of mosquito is not found in Canada, so the risk of infection, say health experts, is low. We'll confirm that in just a moment. However, there have been some reports it could also be sexually transmitted. The consortium is currently working on a vaccine. Public health emergency management expert Dr. Gavin Macgregor-Skinner is a professor at Pennsylvania State University, and he joins us this morning from Washington, D.C. Dr. Macgregor-Skinner, is this a virus that can be passed directly from an infected person to someone else?
Good morning, Brad. This is a virus that gets passed by a mosquito that bites someone that has the virus in their blood and then transmits it to someone else. But we also have evidence, Brad, we've known about this virus since 1947, originated in Uganda in Africa, and we've known that from previous outbreaks in Africa and Asia and South Pacific Islands, that in some very rare cases, the virus can actually exist for a long period of time in the semen of men and can be transmitted sexually.
So that is obviously a danger or a concern. When we talk about 1947 and the discovery of this particular type of virus, why has it become such an issue now?
Oh, this is very interesting, Brad, in that this virus before 2015 really hadn't been seen in the Western Hemisphere. And when Brazilian authorities in May 2015, announced that they were seeing Zika cases and the World Health Organization, there was many more cases of Zika virus patients in Brazil. This is the very first time we'd actually seen it in this hemisphere. So all these people that are out there, like you and I, we've never been exposed to this virus. We have no immunity to this virus.
But just to underline the point, there are the rare cases in which this Zika virus may be found in the semen of men, right? But otherwise, this is a mosquito-borne disease. In other words, it needs a mosquito as a vector. It cannot be, to put it into plain words, passed from one infected person to another by, say, for instance, drinking from the same cup as someone who is infected with this virus, or breathing the same air that somebody's breathing in the room who happens to be infected, correct?
That's exactly right, Brad. Our major concern right now is the transmission of this virus by mosquitoes, and it's a particular mosquito. It's called Aedes aegypti, and so wherever that particular mosquito lives, that's where the risk exists for transmission of this virus from a person that has Zika virus to a person that doesn't have it. And again, that transmission doesn't, people don't have that virus for the rest of their lives. They usually have this virus in their blood, maybe up to 21 days, and then it disappears, it goes away. So that risk diminishes, it completely goes away. But what we're seeing in South America, Central America, and Caribbean states now is where there's been so many people with the Zika virus that it's actually established local transmission through the local population of this particular Aedes aegypti mosquito, and that's very concerning.
I just want to underline a point before I have to go. Mosquito that carries the Zika virus is a mosquito that's not commonly found in Canada. Is that correct?
No, it's not. That is correct, Brad. And I think what we've seen, the Canadian authorities, they've increased their surveillance, and the risk at the moment is for people who travel to any of those countries that have active local transmission. We've seen the Canadian authorities say, look, if you've traveled there, you shouldn't be giving blood at the moment. That's a very good decision. And also we've seen advisories for pregnant women, because this is a very serious situation for pregnant women. For you and I, we may get mild symptoms or no symptoms at all if we get infected.
Public health emergency management expert Dr. Gavin Macgregor-Skinner, a professor at Pennsylvania State University. It's good to get this kind of reassurance.
Thank you, Brad.